Hello again and welcome to Professional Insights brought to you by the National Referral Network. This is where we share, you guessed it, professional insights and wisdom so that we all can learn something. I know I always learn something when I talk to the people we talk to today. My friend John Heck is here. John is a friend of ours in Florida who also happens to be a Medicare expert. We're going to talk about Medicare. I do not understand it as well as probably I should. John certainly does. He was educating me a few minutes ago. So John, let's jump right into this. So the first thing we need to know is that the window of opportunity is between October and December. Is that right?
Yes, October 15th through December 7th is what's known as the annual election period for Medicare.
Okay. And that's when people can do what?
So during that time, they have to make a determination as to how they want to receive their care. Do they want to have original Medicare with a supplement, or do they want an Advantage plan? And if they already have an Advantage plan, that's the time to determine whether or not they want to keep their existing plan or switch to a different plan, as well as their drug plan.
Okay. Let's zoom out of this for a minute. Let's say someone is 64 3/4, right?
Yep.
And they have to enroll in Medicare Part A at 65. Walk us through what they have to do, what they should be thinking about, and try to do the whole thing, remembering that we need to hear this like it's Schoolhouse Rock.
Okay.
Okay.
So about 3 months prior to their birth month, okay, as they're aging into Medicare, okay, the first thing they would need to do is apply for Social Security. So they go 90 days out, they can apply for Social Security.
Now, let me stop there. Do they need to draw? They don't need to draw Social Security. They just need to apply for it.
Yes.
Okay, got it.
That's correct. So they don't have to draw it, but they do have to apply for it. That's the first step.
All right.
The second thing is apply for Medicare. So they need the Medicare number in order to do that.
All right.
Okay. Then from there, we can then shop the different plans that are available to them, the different types of plans, whether it be original Medicare and a supplement or an Advantage plan with an included drug plan, for example.
So Medicare has different layers, and most people have heard of Part A, Part B, Part C, Part D, all the letters of the alphabet.
Okay.
Can we walk through what each part is and how all the puzzle pieces fit together?
Yes, it's very confusing, especially for people who are aging into Medicare. So it's not uncommon for me to get phone calls from somebody even a year out before being eligible, because they're starting to do their research, and a lot of times the more they dig in, the more questions they have and the more confusing it can be for some people.
Okay.
So to answer your question, original Medicare consists of Part A and Part B. Part A is your hospital insurance. Part B is your doctor insurance and diagnostic testing. Okay, that's considered original Medicare. Now, there's certain things original Medicare covers, certain things that they don't, certain things that they pay for that they leave off after a certain point. So you have copays and deductibles in that environment. Okay.
Okay.
And that's why most people will opt to have a Medicare supplement to pick up where Medicare leaves off.
So just to stop there, so we got Part A, which covers hospitalization and major stuff.
Mm-hmm.
Then you've got Part B that covers doctor visits and let's just call it maintenance. Okay.
Yeah.
But Part A and Part B don't cover everything. So what you probably want to do is buy something called a supplement that fills in the cracks, or fills the holes in the cheese, as it were, right?
That's right. It's actually called a gap plan, or a Medigap is another word that's commonly used for a Medicare supplement.
What is the difference between that and this thing called Senior Advantage? Can you go through the differences?
Yeah, so Medicare Advantage, and this is one of the myths that people really don't understand. When you apply for a Medicare Advantage or enroll in a Medicare Advantage plan, what you're doing is disenrolling from original Medicare. A lot of people don't make that distinction. Medicare Advantage is managed care. Okay, it's different than the health insurance where the decisions are made primarily between you and your doctor under original Medicare. Okay, under the managed care, the decisions are made between you, your doctor, and an insurance company, which means
Mm.
the insurance company has the final say as to whether or not something gets done or something gets paid for.
Oh, so that's why they make movies about evil insurance companies. I get it now. So you're talking about so why would anyone opt for Senior Advantage and involve an insurance company in medical decisions?
So if you see any of the television commercials which run ad nauseum during
Yeah.
this time of the year in particular, they will often tout the fact that the Medicare Advantage plans have little to no monthly premium, which is true. What they often leave out of those advertisements is that Medicare Advantage has certain things that they pay for and certain things that they don't. And they have what's called a maximum out-of-pocket limit. And that maximum out-of-pocket limit, depending on the plan, could be anywhere from $2,400 up to over $12,000, depending on
So
the plan.
so it's like, hey, we'll give this to you for free, wink, wink, until you need care, and then you got to pay for it. Is that basically it?
That's right. That's exactly right. And the Medicare Advantage plan also many times, not always, but many times will include the drug plan, which is not included with original Medicare. You have to have a standalone drug plan. And that's a whole different can of worms as well.
Now we didn't talk about so okay, so just to review before we get on to part D. So we've got part A, we got part B, then we've got this. Can you use a Senior Advantage plan along with part A and part B, or does it have to be one or the other?
No, it has to be one or the other. You cannot have both.
So given what you've described, why would anybody in their right mind ever choose a Senior Advantage plan other than they think it's just not going to cost them anything?
Well, I'll give you a perfect example of that. I did a presentation one time for an assisted living facility, and I couldn't have planned this any better, Mike. Sitting in front of me was two elderly ladies. They were both in their upper 80s.
I would have to assume that if it's at a senior center, they're elderly ladies. But okay, keep going.
Elderly for the senior center. Okay.
Oh, that's elderly. Okay.
One of them had the original Medicare and a supplement, who literally said to me during the presentation, I've had this for 20 years and I have literally never paid for a doctor visit or any hospitalizations or anything. No medical services has she ever paid for. The other lady sitting right next to her had an Advantage plan, and she didn't understand why in the assisted living where she lived, they had their own medical services there. And their medical services, her insurance would not cover the medical services where she lived. She lived literally right down the hall from where she lived. And the reason was they didn't take that particular Advantage plan.
So I don't imagine she was very happy.
She was not very happy, but she didn't understand the difference between original Medicare and a supplement being an actual insurance policy versus Advantage being a managed care type policy.
All right. So when you're talking to people, your job and the reason people should talk to people like you who are Medicare specialists, the reason is you're going to walk people through what's best for them. Okay. Yeah. It sounds to me like if this were a choice for people, and I think it generally is, the best equation is part A, part B, a Medicare supplement, which fills in the holes, and then part D. And let's move on to part D. The part D is the drug coverage, right? And this was enacted, I think, 20 plus years ago, something like that. They threw
about 2025.
Yeah. So. And I remember because we used to have to go get meds for my mother-in-law. And I remember there's this thing called a donut hole, which is like, well, they covered the last batch of meds, but now we're in the donut hole and you have to pay for it. And then when you get to the other side of the donut hole, then you can, and I'm like, this thing has a donut hole? Does it still?
It does have a version of it. Yes, they've changed it to be a little bit more consumer friendly. In my opinion, the jury's still out as to how consumer friendly it'll be because it's still relatively new. So
So it's a better donut.
It's a better donut.
More like a bear claw.
Yeah.
Okay, great.
Right.
Right. So what did they change it to?
So with the drug plan, one of the things that's very, very critical to understand is not all drug plans are the same. Sometimes I have people who come to me and they'll say, I want XYZ plan because my brother-in-law has it and he loves it and he doesn't pay for his medications and all this. But one of the things that you have to understand with the drug plan is that it is very specific. The right plan for you is very specific to the medications that you take and the frequency at which you take them. Okay. So what might be a very good plan for your brother-in-law might be a very, very expensive plan for you because your medications are likely going to be very different than what he's taking.
Okay.
Okay. So
Right.
what we do generally, anybody with any kind of experience in this business will take the person's medications. They will put them into a formulary, and we have computer programs now that will shop the plans that are available, and then tell you which ones are going to be the most beneficial and rank them in order of out-of-pocket cost to the client for the coming year.
Okay, so no, that clears up a lot. All the more reason I would advocate for anybody who needs to either make changes in their Medicare or is enrolling for the first time to talk to somebody like you. What is the difference in price for supplements, for what have you? If somebody goes and does this themselves, or they talk to somebody like you, what's the difference in premium?
There is no difference in premium.
Wait, hold it. Did I hear that right? There is no difference. Is that what you? Wait a minute. Don't be pulling my leg, mister.
There's no difference in premium if they were to go to a company website and try to navigate this themselves and select the plan, or if they come to me, it's the same cost to them.
So that is an important point. I actually, of course, I knew that, but I wanted to drive that point home, that if you talk to somebody like John or do it yourself, there's no difference in premium at the end of the day. So there's no reason whatsoever not to talk to somebody like John, right? As a matter of fact, the industry wants you to do that. I think that's why there is no difference. I mean,
yeah, I mean, that's why we're here, because, we deal with this every day. I mean, if I was to, I could probably change the brakes on my car. But if I was to do that, I'd probably, smash my thumb with a hammer. I'd need 4 stitches, and it would take me Friday afternoon from the end of work until Monday morning, to complete it. Or I can go to a professional and he'd do the brake job in 25 minutes and I'm out the door and I had a cup of coffee in between. So, there's professionals for a reason, and I'm a strong advocate of making sure that you use professionals whenever necessary.
I actually tried that once. It wasn't a hammer, but let's just say other tools, and I had disagreements. So I know what you're talking about. Yes. We got to wrap up, John. Thanks for all the great information. If you want additional information, and I don't see the crawl there. We normally have a thing where people can get a hold of you. Well, anyway, you can get a hold of John through the National Referral Network, or seek the advice of a Medicare professional if that's what you need, either you're about to enroll or you want to make changes. Cannot stress that enough. We will be back next week, same time, same station. If you want to check out NRN, you can check out NRN by going to info@nrnamerica.com. Oh, there it is. It's right there. Look at that. You can check out it. So we are onboarding professionals all the time in the network. It's that rising tide raising all ships. It is a wonderful resource pool that any professional can take advantage of. If what you need is a professional that does what you don't, and you want to refer reliably without grave concern that your clients will have a bad experience, we virtually are in the business of eliminating that. I encourage you to check it out. So having said that, we will be back next Tuesday, same time, same station. Thanks, one and all.